Welcome to the Depth Dive. We're starting today with something maybe a bit startling. Did you know that surgery-related incidents, they're actually reported as the most common type of adverse event in hospitals?
It's quite a sobering thought, isn't it? Especially with all the medical advances we've seen.
Exactly. Despite everything, this kind of avoidable harm keeps happening.
And the numbers back that up. Globally, preventable harm is estimated around, what, 6%?
Mm.
And here in Europe, in hospital mortality after surgery is still hovering around 4%.
4%, wow.
Yeah. And a big part of the problem, well, it's been the lack of a single comprehensive, multidisciplinary guideline across Europe for what we call perioperative patient safety.
Perioperative. So that's the whole journey, right? Not just the surgery itself.
Precisely. It's everything from considering surgery, the procedure, all the way through recovery, even after you go home.
It really makes you wonder why getting a unified approach has been so challenging. Which brings us to why we're doing this deep dive today. We're looking at the safest project. Ah, yes, safest. It's a really groundbreaking European consensus study.
Right. So our mission here is to sort of unpack how this huge evidence-based effort managed to get agreement on 101 crucial safety recommendations. And importantly, what that means for patient care and for you listening.
Well, the way they approached it was incredibly thorough. It wasn't just pulling ideas out of thin air. They kicked things off with a massive systematic review.
A systematic review.
Yeah.
Like a really deep search of existing knowledge.
Exactly. Super exhaustive. They sifted through more than 260 existing guidelines, which initially gave them something like nearly 5,000 potential recommendations.
5,000. Good grief. How do they even begin to manage that?
Well, careful distillation. They painstakingly boiled that down to 99 core practices to start the consensus process.
Okay, so they have this core list, but then getting agreement. You mentioned experts.
Yes, 66 experts from 19 different European countries, a real mix of disciplines.
19 countries. Getting that many people to agree on, well, anything sounds like a nightmare. How'd they manage it? They used a clever method, a two-round, modified Delphi technique.
Delphi. Okay, can you break that down a bit?
Sure. Think of it as a structured process. Experts rate statements anonymously, then they see the group's feedback still anonymous and rate them again. It helps find common ground without, groupthink or dominant personalities taking over.
I see. Anonymity helps.
Definitely. And what's really key here, I think, is who was in that expert group. It wasn't just clinicians. They made a point to include patient representatives.
Patients. In the expert group.
Absolutely. Balancing gender, geography, professional backgrounds, and critically, the patient voice. They even had a final 2-day face-to-face meeting to iron everything out.
That's fantastic. Including patients directly in shaping safety guidelines.
So this isn't just another clinical document gathering dust then. No, far from it.
Yeah.
You can really see the impact of that patient input. There's a strong emphasis on things like patient engagement, making sure information is actually accessible and understandable, and continuity of care, that smooth transition between hospital and home. It feels much more patient-centered.
That makes a huge difference. Were there specific recommendations that the patient groups really pushed for or highlighted?
That's a great question. Yes, they definitely prioritize some very practical, tangible things like the surgical safety checklist implementation, making sure the whole team pauses and confirms key steps. Simple, but vital.
Uh-huh. Things that directly affect their experience.
Exactly. Also, comprehensive discharge information. So you understand your recovery plan before you leave, not just handed a leaflet.
Makes sense. Anything else?
Oh, yes. Things like perioperative hand hygiene, basic infection control, and fall precautions for at-risk patients, fundamental safety nets.
Yeah.
Interestingly, they even use ChatGPT-4 to help draft the lay language versions of the recommendations.
Really, using AI for accessibility, that's quite forward-thinking.
It is. It shows a real commitment to making these guidelines usable for everyone, not just medics.
So, looking bigger picture now, these 101 recommendations, it's a European consensus, but does the impact stop there?
Not at all. The foundation, that systematic review, was global in scope, no geographical limits. So the aim is definitely broader. It's about improving quality, standardizing care where appropriate, reducing those disparities we see. The hope is this provides clear, evidence-based guidance that can strengthen health systems and patient safety everywhere, potentially globally, turning safety into something proactive.
A proactive system-wide approach. Okay, so to wrap up, We've seen this huge effort resulting in 101 evidence-based, patient-centered recommendations covering the whole surgical journey.
Driven by that rigorous review, the Delphi consensus with experts and patients, and that final conference,
And really emphasizing that patient perspective, engagement, information, continuity.
with specific things like checklists, discharge info, hand hygiene really resonating.
So here's something to think about as we finish. As these 101 recommendations start to filter into practice, what specific part of the perioperative journey do you think will see the biggest change, and how might that affect your own next interaction with healthcare? Definitely something to ponder.